Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And today I'm here with Dr. Christine Bishop, and we're talking about her upcoming presentation, Doing Nothing is Not an Option. Welcome, Dr. Christine Bishop.
Thank you.
Thank you so much for taking the time for chatting and talking with us here today about your upcoming presentation. But before we go into the topic itself, can you tell our listeners a little bit about yourself and your professional journey?
Sure. So I'm so excited to be able to talk for Gold and to be doing this presentation. And I am a neonatologist and a bioethicist. And I also have a special interest in the practice of neonatal and perinatal palliative care. That's not usually something that somebody, comes out of medical school thinking this is exactly what I want to do. But what I found was that as a neonatologist, there were so many times when I was taking care of babies who were not going to survive or who were born with a life-limiting condition. And I felt like the families and those babies really needed special and very particular care. And so I developed an interest in providing care for those families using the concepts of palliative care.
Well, thank you for sharing that with us here today. And now going into your topic, your presentation is called Doing Nothing is Not an Option. Can you tell us a little bit about your presentation without going too deep because we want our listeners to attend, of course, but give us a little bit of an overview. What you going to be talking about? And you mentioned briefly how you got interested in the topic, but um, tell us also why this you feel it's important that you're presenting on this today.
Sure. So often in the neonatal intensive care unit, or really in any ICU, families will be given the question, do you want us to do everything or do you want us to do nothing? And that dichotomy is really, really just a horrible way to present that. And so the title of my talk refers to that concept of doing nothing is not really what the option is. And there is not an option to do nothing. We will always take care of these children and these families. It's just taking care of them in a different way. So that's what I'm going to be talking about is how to do that for our families with babies who have life-limiting conditions or really complex medical needs. And I think it's such an important topic because while we have the ability to, provide really intensive critical care and, so many different therapies and technologies, sometimes the more human side of medicine and of these decisions is lost. And it's really important, I think, to come back to that and have those conversations with parents and consider the babies as well.
Well, thank you for sharing this, and I must say we are very glad that you're presenting this topic. As you said, it is a very important topic, and i- tell us a little bit about what would you like our delegates to take away from it.
Sure. So, and I've been practicing neonatology for about 10 years. And in this time, and as I created the Care Always neonatal perinatal palliative care service, one of the most important concepts that has emerged to me is the process of accompaniment. And this is something that's very important with these families because all of these conditions are riddled with uncertainty. And oftentimes, you don't know the right words to say, and nobody knows the answer, and nobody can predict what's going to happen. And as I've studied and taken care of these families, the concept of palliative care being accompaniment medicine and walking with these babies and these families through their journey has really emerged as probably the most important part. And so within the framework of accompanying our families on their journey and this concept that I like to call accompaniment medicine, I want to talk about the whole spectrum of care that can be provided in neonatal perinatal palliative care.
The concept of accompaniment medicine and accompanying the journey that you put it so beautifully. Thank you so much, Dr. Christine Bishop, for spending a few minutes here with us today to talk about your topic here.
Thank you. Thank you so much for having me.
And Dr. Christine Bishop's presentation, Doing Nothing is Not an Option, is part of the Gold Neonatal Online Conference 2018. Christine's presentation will be live on June 11th. And for more information on this presentation and when it's being held in your time zone and on the other presentations in the Gold Neonatal Conference, please visit goldneonatal.com. Thank you all for listening, and bye-bye.